Thank you for joining us today on Benovate Explores, our monthly webinar conversation on health, risk, and insurance, really in an ever-evolving industry. My name is Alex Earle, and I am the Director of Client Services here at Benovate. Also joining me is Mike Larkin, a Senior Business Analyst here at Benovate. For those of you who are joining us for the first time today, in the past couple months, we've spent our time focusing on data. Back in January, we had Jake Veely start off our series by talking about approaches to gathering data. And last month, Dave Dune from the NJPA spent time discussing the importance not just of receiving data, but truly understanding what it means, the implications for it, and using that data to drive clear action to meet specific goals. So branching off from that, today we're going to meet our guest presenter and wrap up the conversation we started on data back in January. And then we'll have plenty of time for some questions and answers with our guests. So stick around towards the end to make sure that you can ask your questions. All right, well, let's get started. I would like to introduce you today to our featured guest, Matt Edwards. He's the Vice President at GemCare Wellness. Matt, thanks so much for joining us. Would you do us a favor and just introduce yourself and provide a little bit of background for our audience?
Sure. So name's Matt Edwards, VP at GemCare here. The Edwards family of companies has been around since '92, and my mother and father founded the company. So I've been around it all my life. Current role here is heading up our pharmacy, our wholesale division, and obviously GemCare Wellness. And so we have we're talking about GemCare today and health coaching, and excited to be here.
Well, we're excited to have you. Matt, did you have anyone else for your team joining us today?
Yeah, I believe I see some other team members on here, but I do believe that they are muted. So, but I can handle any Q&A or any questions, or if I can't get the answer, we'll personally send you those results.
Sounds great. Well, thanks again, everyone, for joining us.
Absolutely.
So just to let everyone know, this time is really meant to be, as conversational as possible. Matt's going to start talking a little bit about, to start us off, really the story behind GemCare. Matt, could you really talk to us a little bit about, what GemCare's approach to the market has been and really what you're trying to solve with your services?
Sure. So GemCare Wellness started, our company's been around since 1992. And we've been focused on managing chronic conditions. And the predominant chronic condition that we do here is diabetes. And so from there, in 2012, my father was actually diagnosed with coronary artery disease. And the amount of education and outreach that he received from that treatment plan of how to be preventative moving forward built this GemCare Wellness company. So in 2012, we spent our whole life worrying about the diseases after they actually occurred. And in this way, we've looked at chronic conditions in a preventative style. So we brought in an all-star team to create a solution that will manage chronic conditions before they become exacerbated. And how we do that is through a few things. The first one is healthcare professionals. So we use registered dietitians and certified diabetes educators. Those professionals have a tremendous bedside manner. They've been trained professionally on how to handle chronic conditions, patients. And our success, I believe, is really coming from having that type of personnel on our staff exclusively. So there's no 90-day certificates for getting a coaching certification. These people have gone and got their bachelor's, their master's, have gone and done rounds in the clinical settings, have seen the worst, have seen the best case stories. Mm-hmm. So what we do with that is we look at, I call it the 80-20 rule. So, you have that 20% of your population. It might be 10%, it might be 15%, but they're creating those big claims, on your overall claim experience. And so what we do is we insert our healthcare professionals into those high claimant type chronic conditions. And so we actually take your claims data. So we take the data, we analyze the data, all the way down to ICD-10 codes, any type of coding that we can get on a healthcare side. We look at where those people might be going on a future healthcare cost, and we intervene. And through that intervention is it's not an intervention. What it is rapport building. A health coach can call you and say, hey, you need to eat better, you need to exercise. I want you to do this, I want you to do that. And the first thing that happens is people go and they cross their arms. And then what do you know about me, or what do you. So what we focus on is rapport building and using motivational coaching. And what that means is one-to-one relationships. So you deal with the same coach every time. What we do is we find out what motivates you. Do you have a new dog or puppy you need to exercise? Are you getting ready for a wedding? We get into your personal profile and we share back and forth so that barrier is broken. The first call might be less about what's going on in your healthcare and more about what's going on in your life. And from there, we actually take the motivational coaching, and each call will make sure we have a short-term goal to talk about next time. And so those short-term goals eventually become a long-term goal of attaining better health. So the big thing to take away is we're taking the claims. Everyone can call a wellness program. Everyone can call and say, hey, I've got, someone's running a marathon. They want nutrition counseling. What we're doing is saying, here's some diabetes patients, for just use the disease state of diabetes as an example. Let's look at how we can manage that. Okay.
That sounds great. So specifically with regards to diabetes, because you use that as a good example, what are some of the largest challenges that you see today in terms of getting people that really truly need to engage in those types of services to go ahead and do so? The tendency to be standoffish, to be a little bit hesitant about the buy-in. What are some of your strategies for overcoming that issue?
It's very important that it's identified on that initial conversation. What type of diabetes patient are we talking about? If it's a type 1 diabetic, there's a big stigma. Oh, they, it's because they had a poor diet their whole life. Well, no, type 1 is actually a genetic thing, and you need to know that. And that's something that you're just helping them manage to keep their A1C at a certain level. You could be talking to somebody who was diagnosed yesterday, and they need the basics about what is an A1C test. They need the basics. So the coach will go and actually talk about the basics. We're going to find that out. We're not just going to send them the same literature if they've been in the program for 1 year or 1 day, compared to the diabetes person who's been diagnosed for 20 years or 25 years. And they might have a good handle on what needs to be done. And that conversation will be tailored a little differently, not to insult them on basics. And so it's important to probe and dive deeper into that person's motivational factors of talking to us, and find out where that care path should go.
Okay. So one of the things that we tend to hear in the marketplace, especially from employers that know that they have a population in need of, specific care programs. And one of the questions we get back is, how do you ensure that their care is coordinated? You guys are, focusing very specifically on diabetes or very specifically on, whatever it may be. How can you ensure that we communicate effectively with our members and help them to get connected to all the resources that they need? What type of conversations do you have with the groups that you work with in terms of making that happen effectively and tracking that and making sure that everything that you're doing is reported and shared appropriately?
Data. So, the first thing I'll say is, we get weekly, let's say, claims files or eligibility files. We update that information to see what's going on. We take, notes in a health, I guess they're called SOAPI. So it's a way we keep the notes in our system that can be reported back to anyone who would need to know where people are going, and that could be sent to a physician or anywhere. But there's two-way communication, which is important. Aggregate data is always given, but if you need to get specific to a case, we have that as well. But it really comes down to data and having it organized in a manner that our coaches can understand if they're getting better or not, not getting any better or maintaining, and reporting that back. The biggest thing for us is statistics. We track every biometric, whether it's self-reported or if it's done through a device. So we're all around the disease. And again, we're using diabetes today because we do weight and hypertension and other disease states as well. But the chronic conditions, there's devices that can manage them. We're a large supplier in those devices that can help communicate certain things. We're also in the medication arena too, where we will look at pharmacy claims data, see if people are taking their metformin, for example, which is a diabetes drug. If they're missing that, do we refer them to us, to see what's going on in that compliant side. So we can get all around the disease, not just on a lifestyle, but also on a pharmaceutical and medical device route.
Okay, that makes a lot of sense. I think when you talk about, the importance of data and that it, being collected and even just pushed out and shared kind of in aggregate isn't enough, really needing to coach people to help them manage their disease. Specifically with diabetes in mind, this is a massive, massive undertaking.
Mm-hmm.
Can you talk a little bit more about, GemCare as a team and your approach to really solving this massive undertaking? Because there's so many, I think, points of view when it comes to how best to manage diabetes and how best to engage people and make sure they're doing things like staying med compliant or making sure that they're doing their follow-ups. Can you talk a little bit more on that?
Sure. You look at the slide, 84.1 million people have pre-diabetes. And that will turn into one day a statistic of people with diabetes. It continues to grow. By 2050, the numbers are continue to grow. So what we are doing is, one thing that we look at is emerging technology. So we're on the forefront and supply side with continuous glucose monitoring for the high intensity, insulin dependent diabetes patients. That's lowered A1Cs. Nutrition's a big thing on just learning how to eat smart, eat right, and baby steps, not trying to change it overhaul overnight. But when we look at our diabetes management companies and how they're growing and how many providers are in the space trying to find those creative solutions, what we found is the devices are great, the medication's great, the coaching's great. It all sounds good, but they're all kind of segregated right now. And so you're not seeing, an all-in-one solution. And that's what we try to do, is get all around that person and make sure that every single piece of their journey of managing their chronic condition is met. And it's personalized. So, when you look at, as the disease grows, there needs to be better outreach, preventative programs out there to stop that amputation in the hospital, to stop the eye. There's all sorts of different comorbidities with the disease. But the big thing that we've seen is when you go personal, as hard as that is to manage a large population, you go personal and you work on those 20% of people that could use some help. We've seen the results statistically.
So, I think that's a really good point. You talk about, making it personal and the outreach that has to happen to actually engage these individuals. And it sounds like, one of the things that's been identified as a challenge is just letting people know that these types of programs are actually available out there to help. Correct me if I'm wrong, but it sounds like once you connect with people and can really make that connection and build that relationship with them, you have a much higher success rate. Would you say that that's fair?
Yeah. So if we want to talk data again, I know this is the quarter of the first quarter you're talking about data. Anyone who's engaged with us, I have some statistics to share on where we're at when we engage someone on a one-to-one relationship and we get them to a point to work with a coach on a consistent basis. So, these programs on a short-term level, we're talking 5 to 7 months, and people are usually at that range of that long-term goal. When you look at we have 93 registered dietitians, and some of them are certified diabetes educators as well. And as they go through when we look at the population stats, we're seeing a 7% weight loss from the population. That's about a 15-pound decrease. Anyone with an A1C over 8, which would be considered an uncontrolled diabetes patient, we're seeing on the coaching program, the Diabetes Care Path, 2.5 point reduction in their A1C just by going through this care path, 5% reduction in lipids, a 7% reduction in hypertension. And we also have, again, tobacco cessation. That's about a 25% success rate within the first 5 to 7 months. So what happens is you have comorbidities or co-chronic conditions that are all around diabetes or all around weight. And what happens is if we're working on a deep nutrition therapy program with somebody on diabetes, you can also see that they're losing 7 or 8 pounds on weight just because they're starting to avoid certain foods or starting to substitute certain foods or portion controls and things like that. So the nutrition therapy improves multiple outcomes, not just one.
That's fascinating. And actually that leads me actually into a question for Mike Larkin, our business analyst. Mike, from your perspective, what would you say, taking into consideration everything that Matt's been discussing today, would you say that makes the types of partnerships that Benovate, that has with GemCare so powerful for our members? Can you talk a little bit from your perspective about those types of things that really drive it home and make it a step above what's maybe being seen elsewhere in the industry today?
Yeah, I think philosophically where Benovate falls is very similar to GemCare, which is why there's such a strong partnership there, which is the more data that we can bring into the system, the more personalized and relevant we can make the experience for our users. And that means that we can make the experience more impactful. So the more vendors that we can add into that ecosystem, the more that we can learn about the different various aspects of their life, whether it's through devices, through additional health coaching, or through our own internal mechanisms like our HRA, the more that we can learn about the members, the better that we can target them with interventions.
So that's interesting. So Matt, thinking about Mike's statement and coordinating some of the different types of programming available and making sure that they're relevant to the user, would you say that it's relatively common to have individuals that are maybe engaging in more than one type of program at once?
Absolutely. Yeah. So if you look at someone, let's say you have a member in the program that is 20 pounds overweight, and they've been diagnosed with, I would call it like a pre-diabetes. While losing that 10 to 15 pounds on that and then getting to their goal of 20 pounds, all of a sudden those blood glucose levels have gone to the normalized ranges. So you see those co-chronic conditions on more than just one disease state. You'll see it across the entire board. But again, I'll stress it's important on that first call or that first interaction with the person to understand where they're at in their chronic condition. Do they understand it? Do they understand, where they want to go and what's motivating them to actually make this call? And Benovate's been a great solution for us because it puts what we're trying to show the incentive to people of this is not going to just help you on a lifestyle. It's going to save you costs too in the long run for both the the employer, employees, and obviously the employee will feel better, more energy, and all the things that happen with better health.
So for the type of, say, employer group or maybe even the broker consultant out there that is taking a look at a population and thinking, based on claims, based on the risk trends that we're seeing within our organization, we know we need to get there somehow, right? We know we need to provide some sort of solution. What are some kind of basic level questions and things that group should start to think about when they start to evaluate potentially bringing a program like GemCare into their fold of their overall health and wellness strategy?
Sure. So I call it the high claimants, but when you look at a lifestyle assessment, so a lot of insurance plans will give you a what's caused by things you couldn't control, and then what are things that are controlled by lifestyle. Diabetes, poor nutrition, things like that always show up on the top of those lists. And what we're simply trying to give a broker consultant ammunition to say, hey, if diabetes is your second biggest claim, that is something that can be prevented. I've got a solution for you. Here's a diabetes care path program from Benovate Care that will actually manage those people, get their A1Cs, work on their lifestyle and things like that. It's not a coaching program for every single person. The person who's running a marathon is going to want different nutrition than the person who is just diagnosed with diabetes and trying to turn it around. So we're focused on, again, getting into someone, seeing what they're motivated by, getting this motivated by in a broker level too. So we want to be able to make sure that when they're coming in with some bad news, or if they're coming in with some things that need to be addressed, there is a solution for that broker right there and then. This is the problem, but here's something you can do to solve it.
Thank you very much for that. That's, I think, really pertinent. A lot of times people know that they need to start, they just don't quite know where and when. So
Absolutely. Yeah, it's something where we're going to get into the claims data. We're going to get in there and show some more additional solutions than you would get on a traditional wellness program.
Okay. Well, taking a look at the time here, we're actually getting to the fun part of this. So at this point, we're actually going to invite the people that have joined us today to take yourselves off mute and actually join our discussion. So does anyone joining us today have any questions for Matt or the GemCare team? And remember to, I'm sorry, go ahead. It looks like we have a question.
Actually, it's an internal question here. Matt, when you brought up some of the sort of additional psychological factors that, someone is competing with when they're trying to make a change in their lifestyle. Mm-hmm. What are some of the sort of most prominent lifestyle barriers that you see, the psychological things that you see that, your average broker or, your average doctor might not necessarily be aware of when they're trying to create that change?
Right. So one of the things that we actually put into our coaching is, and a lot of employers already have this, but an EAP, Employee Assistance Program, mental health. If someone's not ready to make a change, if someone's not, financially there, or someone's having, at-home issues and things like that, a lot of the times those things need to be addressed first before they're able to sit there and say, I'm going to make a lifestyle change. So a lot of the times we will refer out to a company's employee assistance program. Again, it's an underutilized resource that is actually quite valuable to help people get back on track on a mental health level. And then from there, we're able to intervene and come back to, okay, I'm starting to feel more self-worth. I'm going to make this change now. And here's psychologically how I'm going to do that. In a physician visit, it's really hard for them to diagnose that in the 10 or 15 minutes that they're doing that. But one of our health coaches, they're trained professionally to identify red flags for that and refer out as needed. Does that answer your question, Mike?
Absolutely. Absolutely.
Okay.
Matt, I have a question actually that came in here. One of the questions was, do you see any new trends in how diabetes care is approached?
Oh, yes. I could take an hour to talk about. So we are a partner of some new emerging technology products out there. Diabetes test strips, which is you take a finger stick and you get a result in time, is the kind of the type 2 diabetes patient. That's their typical regimen, once a day, twice a day. But continuous glucose monitoring, which is an emerging technology, is becoming a product that is exploding for us, because it tells your results every 1 minute, 5 minutes. You're getting a glucose result, and it's starting to create a trend graph that a doctor can evaluate and adjust insulin and things like that accordingly. So that part of our business has exploded, because they're becoming more affordable now, and they're actually the coverage across plans is there. And those devices themselves already are showing A1C reductions alone just by waving a monitor over your arm or looking at your thing, saying, "Oh, I need to cool it off on the blood glucose," or I need to cut my portion here, or I need to eat something. It keeps you more in range. So again, we take tools like that with the coaching. Obviously, there's a lot of smart technology out there now, a lot of glucose monitors and other products. They connect to the phone, they download results. Our coaches could see those results, things like that. Those are all custom programs that are part of our diabetes care path. But our sister company is one of the largest mail order providers in the country for a lot of those emerging technology products. And we actually contract with insurance plans across the country to handle those uncontrolled diabetes patients through devices.
Okay, so it sounds like for the individual, that would be just exploring maybe some new or some better ways to actually get engaged and manage their diabetes more effectively. It sounds like part of what they would do then is work with their coaches to figure out how best to use those devices, how to track all of their progress through the use of those technologies.
Mm-hmm. Yeah, so I mean, diabetes compliance, number one, is, are you testing? A lot of the times it's just, you need to get them to test. And that's one thing we help with, to make sure they know where they're at. But then that next level, that emerging level, is if someone's out of control and they're coming in with A1Cs of 9 and 10 and 11, there's devices out there, even if that will really get you a clearer picture of what's going on throughout the day and night.
Once again, a great illustration of the power of data, right?
I'm right back to it, right?
Well, and I think that actually sums up our time. I think that's a great point to end on. Were there any final questions from the participants here today that you'd like to throw out before we wrap up our time?
When you're talking to patients about their tracking their A1C numbers, Benovate connects to a good number of glucometers when it comes to helping those patients. How aware generally are they that insurance will cover certain devices like that so that they can start tracking their diabetes?
Well, the problem is, you get a prescription and you hear that your copay is $60 and then no one fills it. I mean, that's what happens. So it's important that people start looking at breaking those barriers down and making it more affordable, because products have become more affordable. If you're not buying you don't have to go with whatever the doctor said. A lot of them are just generic prescriptions. So you can actually go with something that's, I call it smart shopping, but go with something that's reasonable in your budget, so you can actually test. But the coverage, what I'm seeing, the trend now is people are going to zero copays on products to get people to test, so that they don't end up in the emergency room with 1,000 blood glucose level. So the trend I've seen is just educating people that there are ways to get affordable diabetes supplies, because the stigma is it's all grouped in with the medications and things. There's expensive medications and there's low cost medications. There's expensive devices and there's low cost devices. But the diabetes industry has gotten the stigma of, everything's expensive and I can't afford it, period. But that's not true.
I think that's really interesting. The focus on staying in front of the member, staying in front of the patient, not just once or twice a year to let them know that their diabetes medications are covered and that their plan includes X, Y, and Z, right? Once a time in enrollment, but really making sure that there are various points throughout, the months or the years to make sure that we're reminding people that those resources are there and available for them at low or no cost. So.
Right. Exactly. That's the biggest thing we can do to keep compliance there.
I agree. Well, I think that wraps up our time for today. Thank you again so much, Matt. Thank you to the rest of the GemCare team, and to really all of you for joining us today on Benovate Explores. Make sure to join next month, April 18th at 11:30 a.m. Central for our next episode in the series. This spring, we're going to start to shift away from our conversation on data and shift towards engagement and the various strategies for different types of populations. So I think the way we wrapped up our conversation today was just about perfect. As always, if you have any feedback or additional questions for our guest speaker, please let us know. We'd love to hear it. And thanks again, everyone. We'll see you soon.
Thank you.
Thank you.